Hi, welcome to the Labor and Delivery Unit. We are so honored to be part of your birth story. To help you feel prepared and safe, we want to walk you through some of the routine procedures and options that you will encounter during your stay. First up, we have admission procedures, IV insertion. One of the first things that we do upon admission is place an IV. This is a small plastic tube that goes into a vein in your arm or your hand. We do this for your safety. It allows us to give you fluids to keep you hydrated and provides us immediate access if we need to give you medication for nausea, pain, or any other emergency. Next up is admission labs. We will also draw a small amount of blood. The reason for this lab work is routine to ensure that everything in your body is okay. First, we check a CBC to make sure that your platelet count is high enough for an epidural, if you choose to have one, and to screen for infection or determine if you're at risk for infection. We can also do a type-in screen, which will help us to determine your blood type and whether or not you are positive or negative. This is a crucial safety step in case you experience bleeding and need any blood products during delivery. Next up, we have pain management. These are IV meds and nitrous oxide. You'll have several options for pain relief. First, we can use IV medications like fentanyl or Statol. These don't take the pain away completely, but they do help to take the edge off and allow you to rest between contractions. We also offer nitrous oxide. This is where you hold a mask to your face and breathe in the gas during a contraction. It clears your system quickly and is great for reducing anxiety. The most effective pain relief, however, is the epidural. If you choose to do this, an anesthesia doctor will place a tiny catheter in your lower back. This will help to numb your stomach and your legs. You'll feel pressure, but the sharp pain of contractions will fade. Once you get an epidural, your legs may feel heavy, so you'll need to stay in bed for safety. There are also many non-pharmacological pain management options if you don't want to opt into medications. These could include massage and visualization techniques. It's whatever you choose, and it's entirely up to you. Next up, we have Foley catheter placement. If you choose an epidural, you won't be able to feel when you need to pee or get up to use the bathroom. We place what we call a Foley catheter, which is a small sterile tube to keep your bladder empty. We typically wait until you're numb so that you don't have to feel insertion. Keeping the bladder empty is vital because a full bladder can actually act like a roadblock and stop the baby from descending. Next, your support team. First, I want to note that you have to check the current visitor policies of the hospital to see how many people are allowed, but we know that you want your loved ones close. Typically, you're allowed your primary partner and additional support persons, such as a doula or a parent. They can be with you throughout your labor and delivery process. Our goal is to create a supportive, loving environment around you. Immediately after birth, assuming that the baby is stable, we place the baby directly onto your bare chest as requested. This skin-to-skin contact helps to regulate the baby's body temperature, heartbeat, and respirations. It's also the perfect time for bonding and the first latch. Next up is lactation support. If you plan to breastfeed, you're not alone. Our nurses have trained to help with that first latch. We also have certified lactation consultants who can visit your room to offer expert tips, check the baby's latch, and answer any questions that you might have to ensure that you go home confident. We hope that this gave you a better idea of what to expect. Remember that this is your birth experience. If